for having me again. Good to see all of you. And what I want to cover today is just kind of give you the status, the state of the state employees' health insurance plan. It's been a tough year for many of us with COVID. I know many of you have suffered with COVID. Many of you know individuals who have died from COVID. So it also has had an impact on our health plan and many of our members. We started last year in January 2020, and for many of you it was a time of change, because if you were under the Medicare program, you saw that the carrier was changed. And anytime we make a change in carrier, there's always that concern that folks have, okay, what are we really going to get here? I know there was a lot of meetings that took place around the state prior to United Healthcare coming on board. And basically what you were seeing, and hopefully now you have had an opportunity to experience now that program has been in place for a little over a year, is that you have seen some reduced office visit copays, you've seen reduced drug copays, you have seen reduced copays in other areas. Just to give you some stats, now that we've closed out 2020, the payout currently in that program is at 89.5%. Now you may say, what do you mean, William, payout? It basically means that the plan is paying 89.5% of all the expenses. The other 10.5% is coming from you in the form of copays. Put that in some context, where were we 10 years ago? 10 years ago, the payout was 81%. So you can see that we have made some improvements in those benefits over the last 10 years, and especially in the last year and a half with United Healthcare, improving the benefits that you have through your Medicare Advantage program. There's also some additional benefits that are available through United Healthcare. I hope most of you have looked at the materials through the year, over the past year, and know what those benefits are. But I want to just highlight a few of them in case you're not familiar with them. And if you need more information, there's two ways that you can get information today. One, there is a telephone number on the back of your United Healthcare card for those of you who have United Healthcare. Just call that number and ask them about these programs. They have excellent customer service, and they're there to assist you. Also, I've got some of our staff that are here in the lobby at the tables, and they have some information on these programs as well. So if you have any questions concerning any programs with United Healthcare, feel free to stop and pick up the materials from the staff. Just highlighting a few of them. One of them is house calls. This is preventive care visits at the convenience of your home. Now, I know I've heard from some folks that, I'm not used to getting this phone call and having some stranger come into my house. But I also will tell you, though, the folks who have taken advantage of this program love it. Okay? So certainly is a program that I would ask that you, if you have not considered it and have not taken advantage of it, take another look at it. Another really nice benefit that's in the package is post-discharge meal deliveries. Now, when you're discharged from the hospital, most of the time you're not feeling real well. This is a really nice benefit. Up to 84 meals can be delivered to you free of charge. Silver Snickers, which has been a very popular program, is also in there. That's a fitness program. And then you also have Real Appeal, which for those of you who don't want to go anywhere, it is an online weight loss program, and we are seeing quite a few of the Medicare retirees taking advantage of that program. There are several other really nice programs. Either talk to the United Health reps and find out more about these programs, because those programs are out there for you to take advantage of, or ask our staff today as you walk into the lobby. Overall, the program seems to be a huge success. As a matter of fact, when I just mentioned United, I saw a couple of you thumbs up, and that's certainly good news. That's what I want to see as an administrator, that when we put something new in place, that it's meeting your needs and it's meeting your to your satisfaction. In February of this past year, though, I think we all are fully aware COVID hit. And COVID hit our program very hard. Back in the end of March and all through April, May, and even the first part of June, we saw healthcare facilities pretty much shutting down and only taking care of COVID patients. So what happened to our claims costs is kind of the opposite of what you may have thought. Our claims costs went way down during those months. But we were getting the COVID cost in. Things started to pick back up, reopened as far as the medical community back in the summer months and into the fall, but we had not hit the peak of the COVID crisis until December 2020. And that peak went all the way through February of 2021. For 3 months, our program and our members were getting hit very, very hard with the COVID virus. To give you some stats, over the past year, we had over 1,300 admissions for COVID. We had 419 ICU visits. 153 individuals were on a vent, and we suffered 1,168 of our members died. Folks, when I look at these numbers, though, and the thing that is really alarming is that 1,134 of the 1,168 members were in our Medicare Advantage plan. Okay, it hits the people that are over 65, and especially those with any kind of underlying medical condition. It hits very, very hard. When we look at those that were under 65 and not in our Medicare plan, we had 34 deaths. So you can see the population that this virus is really hitting hard. As most of you are fully aware, the COVID vaccine is now out there and it is available. I hope that most of you have taken advantage of that. If not, I would encourage you to get vaccinated. This is a real virus. It's killing a lot of folks, and I would certainly encourage you to look. There's plenty of providers out there now that are providing this vaccine. So again, I would encourage you to look into that. The overall expenses that the plan incurred on COVID was $24.5 million. So about 5% of our overall expenses for the year were COVID related. The good news is the federal government has already reimbursed us for $10 million of that. And with the new Relief Act that passed this past month, it looks like we will actually get reimbursed for the remaining $14.5 million. So that will certainly help the financial condition of the plan. Talking about the financial condition of the plan, it remains financially sound. We're still doing very good. We've had 10 years of really good control of the expenditures. I gave a handout, so I hope everybody's got that handout. And let's just share with you what's going on in the market versus how we're faring. The graph that you have, let's look at this first page here. This is the part, this is a national survey. This is a PricewaterhouseCoopers survey. This is a large consulting firm. And a lot of folks in the healthcare arena, we look at this to compare how other people are doing across the country versus how we're doing. Notice this trend, though. Back around 2007, you can see that it was double digit, but then 2010, you were running about 9%. It came down some, got the lowest, it was 5.5%. Now, when you turn the TV on and you watch the news every day, you're seeing healthcare is constantly in the news. This is why. Just think, if you were facing this kind of inflation year in and year out, and you saw your premiums and your co-pays going up at this rate, you would eventually get to the point it's not sustainable, you could not afford it. And that's what's happening on the national level. When we look at what's driving the majority of this cost, it's prescription drugs. These drugs that you see on TV, these commercials, one night just get on your iPad or your computer and look them up. They are very, very expensive. We no longer just spend hundreds of dollars on prescription drugs for a person. We no longer just spend thousands or tens of thousands. We have individuals that are in hundreds of thousands. We've even had individuals that got up to one individual, one injection, per month, $6 million. Yeah, next year it was $4 million. Okay, that is what the headwinds we're facing with prescription drugs. And I'm here to tell you, we still don't have an answer for the prescription drug side of it. Turn the page over and you will see the trend. And we'll start off, if you take that trend that was on the previous side and you apply it to what our costs were in 2010, which was that far left-hand side, $429.4 million was how much we were spending in our health plan. You apply the national trend year in and year out to that number, and you look up there, the red line goes up, and it gets up to $824 million. That is a 92% increase in cost over 10 years. Again, that is not sustainable, and that's what, on a national level, what people are facing. You look at our plan, that same $429.4 million, you can see that over the 10 years, it has remained flat. Today, this past year, we ended up, and these are all audited numbers, CPA provide these numbers back to us, $433.9 million is the expense in 2020. So you may ask, how have we been able to keep the cost level? Well, a lot of it is by putting things in place that this association has been behind us and supported. Some of it was legislative, some of it was at the board level, but these are things that we have been able to put in place to control the cost. One of the first ones goes back to the reforms we put in place back in 2004. I had a list of 6 things that I felt that we could reform our program, some initiatives that we could put in place, but we need legislative help. Governor Riley at the time agreed to that, and we had a special session. We approved those reforms, and those reforms have worked very, very well. The most recent year, CPAs reviewed, and the savings from those reforms in 2020 was $88 million. Second thing that has really helped us is switching to the Medicare Advantage. That's the United Healthcare type benefit. That saves us $30 million annually. And then the third option program that we put in place, an initiative that has really had the largest impact, has been our wellness program. The wellness program has worked extremely well. We have now had that program in place for 14, 15 years. And basically, most of you have participated. We get very high participation rates. We know every year, though, we're going to identify 10% of our population that's not just at risk, at high risk. And those are the individuals we want to go and receive health care. We want them to get their condition taken care of and managed. We are able to look at that population that was at risk a year later. 90% of them have improved. Not only did they improve, they made substantial improvements in their health. You look at blood pressures, they go down 20% over that period of a year. Glucose is down 34%. Cholesterol levels are down 24%. Again, that's after 1 year. Well, as I said, we've been doing this program for a long time now, and we can also look at these same individuals that were at risk 10 years ago. Where are they today? Guess what? They have been able to maintain that level of improvement. So when you are looking at individuals that were at very high risk and now you bring them down to a more normal risk, they're going to cost less. And that's what you see in your healthcare trends here. That's how we've been able to keep that trend flat, is we simply have made the population healthier. All of what I've just described on those 3 initiatives and reforms, we could not have done it had it not been for this association. So I want to say thank you to the association, especially to Leanne Kelly, because she's always been there fighting for us. You see Warner Floyd over there. I know back when he was around as the director, he also was very supportive of this program. So again, I want to say thank you to each one of you for your help. So as you can see, the health plan is doing well. We'll look at the legislative funding. Legislature has basically been very receptive to the programs that we've put in place and the plan we've put in place to control costs. And they also, though, have been there to support in the funding of our program. 2010, the state funding was $362 million. Last year, it was $360 million. So we actually had a $2 million decrease, but primarily it was because of a small decrease in enrollment. Current year that we're in, which is fiscal year 21, we also received level funding, which is what we requested. And we're also, for fiscal year 22, which is going to be for next year, we're also asking again for level funding. The program is doing very well financially, and level funding is what we requested, and it looks like that is what we will get. For fiscal year 22, that final decision is still over in the legislature, but I will tell you, the governor has been very receptive and supportive. She put it in her budget that we get the requested funding, and thus far the legislators and the ones that you're hearing from today also have been very supportive of our funding. So, again, I want to say thank you to those in the legislative process and the governor's office, but I also would encourage you that as you see each and every one of them, express your appreciation. It goes a long way when you say face-to-face to those individuals, thank you for your support on the state employees' health insurance program.